Welcome to another Micro Summit installment from the Council of State Governments Eastern Regional Conference, Council on Communities of Color. This is our Micro Summit series on COVID-19, on equity gaps in COVID-19 during this pandemic. I am Charles Ellison. I am the moderator, also producer of these discussions, of these Micro Summits, which we've been having every bi-week, pretty much. And with this particular Micro Summit installment, where we're focused on public health issues, is done in partnership with, in conjunction with Healthcare Ready. Go to healthcareready.org for more information there. We have the Executive Director of Healthcare Ready joining us on the panel today. We're going to introduce her in just a few moments. Once again, I'm Charles Ellison. I'm your moderator for this afternoon. We're going to go on for about an hour having a discussion about, well, now we're going through reopening phases in a number of states and a number of places. So now everyone's venturing outside. People are going outside. So there's a big question that's attached to that. It's how do I protect myself? People are wondering, how do you do that? So we're going to try to have some very pragmatic discussion, provide some practical advice here during this Micro Summit. I want to thank once again the Council of State Governments Eastern Regional Conference, Council on Communities of Color. You can go to CSG-ERC.org. That's CSG-ERC.org for more information, particularly on the Council of Communities of Color. You can reach me on social media, by the way, at Ellison Report on Twitter.com, #RealityCheck. I'm also on WURD's daily public affairs show called Reality Check, and that is on WURD. You'll go to wordradio.com for more information on that. #CSG COVID-19 for social media discussion on the topics that are being discussed today. Let me real quick introduce the panelists, and then we'll go ahead and get started. Dr. Nicolette Lewis-Saint is Executive Director of our partner for this public health series, Healthcare Ready. Go to healthcareready.org for more information. You see her to the right of your screen. Also to the bottom right of the screen is Debbie Ann Page. She is actually and she's our producer. She's really the creator, co-creator of this series. She's making this possible. She is Senior Policy Director at the Council of State Governments Eastern Regional Conference, Council on Communities of Color. So hi there, Debbie. Thanks so much. Also joining us is Micheline Davis, who is Executive Vice President and Chief Corporate Affairs Officer at RWJ Barnabas Health in New Jersey. Micheline, how are you doing? Thanks so much for joining us. She's in the upper left-hand corner of the screen. Reverend Dr. Miriam J. Burnett is the Medical Director of the AME Church, that stands for African Methodist Episcopal Church, of which I am a member. And she's Medical Director of the AME Church International Health Commission. She joins us. She's at the bottom of the screen in the middle right now. And also joining us, gracing us with his appearance, is the Honorable State Representative, Delaware State Representative, Nnamdi Chukwucha. He represents district in the state of Delaware. He's also a part of CSG ERC, joining us here for this discussion. Okay, so I'm going to put this out here. Nicolette, we'll start with you, and then everyone else can jump in. A number of states and municipalities, townships, cities are starting to reopen. There's some risks that come with that. There's a lot of anxiety that comes with that. I want to get your first impressions of how those reopenings are going and the worries and concerns that you have about that.
I'm anxious as well. They're just starting, so I think it's going to take us about 14 days to really know how they are going. It's not just about reopening, but how the reopening plans are put in place, what the policies are, how social distancing is maintained. As many of our colleagues have continued to remind us, if in the absence of a vaccine, we have to maintain a lot of these measures until we actually have a vaccine in place. And so there's reopening, but there's also the question of how we are going about reopening. So I just received an alert. Many beaches are going to be open for Memorial Day or before Memorial Day. I've never seen a beach where you can maintain social distancing. So there are a lot of questions about that, especially in places like New York and New Jersey that have been hardest hit and are very much areas of concern. Similarly, though, when you're thinking about regions, you're seeing a disparity between how states who are in compacts are choosing to reopen, what they're choosing to reopen, and how they do that together. And again, it's how we reopen that needs to be really carefully considered. Been doing some great work and learning a lot from Dr. Burnett, as we've also been talking about church reopenings and what does it look like for the physical church to reopen. And so again, it's how. What we're starting to see is also what's being called quarantine fatigue. So recognizing that if you don't have a structured reopening, people will reopen things for you. So making sure that we are thinking about how to do the communication related with the safety measures that need to be taken, and that we truly are doing this in a phased way, because it will take us about 14 days to be able to see whether or not we're seeing an increase in cases related to those shifted policies.
Representative, I want to go to you because Nicolette said the key word beaches, and Delaware has a lot of them, right? So I'm not even sure if your district represents any place where there are those beaches, but there was this recent Health Affairs Journal study that just came out. It was finding that areas without social distancing measures, or areas or places that defy social distancing measures, have 35 times more cases, more COVID-19 infection cases than other places that are following those measures. Just to get the perspective of a legislator, of a policymaker in a time like this, and trying to strike that balance between this rush to reopen because of the economic concerns and also trying to maintain that public health layer as well.
Yeah, absolutely. I mean, and I fortunately or unfortunately, but I do not represent the beach area. I'm an urban area in the northern part of the state, but we know that our southern neighbor, Maryland, put out a statement about their beaches, so Delaware had to follow suit. So we're working with them on that accord, but it's really about risk management. We know all of our economies on every level, city, county, state, federal, are all suffering. And that's impacting the quality of services that are being provided. So again, it's about risk management. You can't really have a healthy economy without having a healthy community. So we have to really take into effect the impact that it's having. And as we do so in a very cautious way that takes into account the disparities within certain communities, and ensuring that individuals and communities are protected, given the most safeguards that possible.
Micheline, would be real curious about how hospitals and medical institutions are feeling right now, like the medical institution you represent, and how are they feeling? You know, how are folks who are those frontline medical professionals? They're seeing all these reopenings happening. There's this big conversation about a potential second surge. We're already seeing spikes in cases and in deaths as states reopen, like Georgia, Florida, and Texas come to mind initially. What are your thoughts, and what are people thinking? I'm sure you're sort of bracing for the worst as these reopenings happen.
Yeah, thank you, Charles, for the question. What I will tell you is we actually talked about that just this morning, and our concerns are significant. As a matter of fact, our governor also, of course, announced the opening of the beaches for this weekend, and this morning at 6:45, there were already cars lined up along the boardwalk of young 20-somethings who were bounding out of their vehicles in order to literally already be there. So we're very concerned deeply. We, like our sister New York, was really significantly impacted. And so quite frankly, what we are most concerned about is two things. One, not only will we see the fact that individuals will A, no longer socially distance, and B, think that wearing a mask is actually an option, but also the fact that the resurgence that we keep hearing about, was anticipated for the fall, is actually going to be here by July. And if that occurs, we cannot quite possibly imagine what's going to happen during that period. What's additionally concerning is the fact that those who are of the essential workers who, as a result of the reopenings, right, have been on the front lines, they're going to have to remain on the front lines, right? They're not going to all of a sudden now have vacation time. They're going to have to continue working, right? So stocking your shelves and delivering your food, right? But in addition to that, they historically and definitely what we're seeing in the present day continue to be from those populations which are most disproportionately affected, right? So they are from our Black and brown communities and families. This is us. And what we know is that as a result of the reopening, it's actually going to pour more of us with our underlying conditions much earlier in life, right? We don't just wait till 60, 70 in order to have high blood pressure or hypertension or diabetes, that we are in our 20s, 30s, right, 40s and 50s. And so it's going to pull even more of us out into the area of exposure with individuals who, some of whom are quite cavalier. And so we are significantly concerned about a variety of things. Two things. One, we're seeing that it's not just, flattening the curve is really significant, but this is coming at us in waves. And so right now in a northern portion of the state where we have a large segment of the hospitals within our system, we're beginning to be able to take a deep breath, right? And we're seeing that we are at least discharging more individuals than we're admitting. But our hospitals in the central portion of the state, there are only 6 hospitals that are there, 4 of which have been on divert, right? We have shifted equipment and staff and, that COVID protocol literally to that portion in particular. So what happens if, as it then hits the southern portion of the state where we also have hospitals, what happens then if in fact we're already at July and it hits us again in the north, right? Yeah. So we're back to that discussion around, right? Critical standards of care for ventilators, et cetera. So this is something that is very and deeply concerning for us.
Reverend Dr. Burnett, this has been a very trying time for Black churches, of course, and for their congregations. A majority of Americans, about 65% of Americans, go to church on an average Sunday. Before we kind of get into some other questions about kind of basic protection measures, I'm real curious about the guidelines that you, as a representative of the medical arm, of the public health arm of a major international church for that matter, what are the guidelines that you're following, particularly and what are you telling congregants, particularly some of the, I've heard this from a lot of Black clergy, especially, even at my own church, a lot of the older members, they really want to go back to a physical on-site location. So they may take advantage of this reopening situation to put pressure on clergy to say, hey, let's go back, let's do it on site. But what are the guidelines that you're following now? What are you telling congregants?
Well, we have actually done a trial run of a train the trainer last Saturday. About 50, 55 people on the line. The Health Commission developed guidelines with a core team led by myself of scientists as well as chemists, scientists meaning microbiologist, a virologist, 3 physicians, 2 nurses, a chemist, and 2 bishops in particular, on just hashing through how we would make an approach. On yesterday, I met with our Council of Bishops and we walked through that line by line. It is imperative that we have guidelines that go deeper than that which is publicly available. Can I put it that way? Because they do not speak to our needs. The guidelines that are coming out of the AME Church talk about how do you deal with people who are in the spirit, quote unquote. I've not seen that anywhere else. What do you want to do about anointing? How do we deal with baptism? How do we deal with communion? How do we deal with all of the rituals, liturgy, and common practice? How do we deal with funerals that are now going to come back into the church? All of those are addressed in a real way in this document that I should have released sometime this weekend, if not by early Monday morning for public consumption. And then we'll be doing train the trainers, because we have to be able to tell people how to move forward. Your concern about those who are elderly is paramount in our minds. We have a phased approach. They don't get to come back until phase 4. They're going to be hot with me. But
I can imagine, right?
I'm expecting to get grandmas and grandfathers and great-grandmothers and great-grandfathers calling my phone and blowing me up and calling me everything but a child of God. But we have to protect them. If you won't protect yourself, we have to do it for you.
Okay, so once again, if for those of you who are just now jumping in, saw a few people jump in, we are having a discussion about going outside. How do I protect myself? We're going to get into some more practical discussion about best practices for going outside, for now navigating in this reopened or slowly or gradually reopening society during pandemic. I'm Charles Ellison. I'm your moderator, being joined by a pretty much got an array of some of the best experts in the field for this discussion, being brought to you by the Council of State Governments Eastern Regional Conference, Council on Communities of Color, and also Healthcare Ready. Go to csg-erc.org for more information. Also healthcareready.org as well for more information on our sponsors, on our partners for this event. Okay, so Nicolette, I'm going to go back to you. What are the best practices when we start going outside, when we start venturing out and leaving home? We were already kind of exercising this, doing sort of the essential stuff like going to the grocery store, getting supplies. But you know, do we wear masks? Do we wear both masks and gloves? There's a lot of confusion and some mystique around exactly what you do as things reopen. As it gets warm, people are going to parks. Do you wear a mask then? So people want answers on that.
Sure. So I smiled when you said should we go about going back out, because my immediate thought is don't. But if I am to give you an answer other than that, I first want to actually start and lift up some new science that I think is really important, and the WHO raised it this morning, that we are learning more about the impact of COVID-19 on children. And what was once thought to be a population that was relatively asymptomatic, concerned as a carrier, is actually beginning to, in part because there are more kids that have been infected, beginning to become a population of grave concern as it relates to cascading syndromes and infections relating to having been infected with COVID. So I want to acknowledge that it's important for us to think about everyone as a vulnerable population, and not just some, but there are those that are more vulnerable, and we need to make sure that we are doing more for them. So protective equipment, yes, I think it's important to think about masks first and foremost, to remember a couple of things. One is that a cloth mask is not protective equipment. It is hygiene. It is a hygiene tool. So when you are using a cloth mask, you are doing it for your own safety and for those around you. So if you sneeze as you sing, or if you are, speaking and there are droplets that are coming out, it is a hygiene tool. It is not the same type of medical tool that a professional would need. It is not a surgical mask. It is not an N95 mask. For most individuals who do not have chronic illnesses or have a condition where their immune system might be further compromised, a hygiene tool is sufficient. In addition to other things, gloves are a best practice, especially if you are going to be touching surfaces. The challenge that I'm running into with giving guidance related to the type of equipment one should wear, or the types of masks or other types of considerations one should take, is that if you're not careful, the use of gloves or the use of a mask will give you a false sense of security.
Yeah.
And you can actually find yourself putting yourself at greater risk because you are using gloves, and so you are not being mindful of where your hands are, including when those hands with gloves touch a surface and then touch your face, or touch the mask and then touch the inside of the mask. And so making sure that we are not relying on these tools, these hygiene tools, this protective equipment as an alternative to social distancing, as an alternative to careful practices and continued hand washing is very important. And I think that's the biggest piece. I do not think that a park is a good idea right now. That is my personal opinion as an informed professional. But I think that's in part because I cannot guarantee that I can maintain at least 6 feet of distance if it's an 80-degree day and everybody's having the same idea about going outside. And I do think this gets more difficult as we get into warmer times of the year where not everyone has air conditioning and not everyone is able to just stay at home in such weather.
Yeah, Micheline, what are your staff telling patients or potential patients or individuals? What sort of messaging is your institution sending out about how people should maneuver in a time like this? Also guidelines for masks and gloves, etc.
Sure. So I want to say ditto to everything that Nicolette just said. I really completely agree that if in fact you do not have to go out, then don't. And quite frankly, I want you to reevaluate whether or not you surely do have to go out, right? It's one thing between saying that I want a different brand of X than it is actually saying, you know, I'm completely out of X. And so I really want people to come back to the basics, come back to the fundamentals. Remember a time when you did not have all of these options in order to really just take care of yourself. The thing that we have really been telling individuals is that nothing beats social distancing. Absolutely accurate about the fact that there are that masks are really utilized in order to protect others, not to protect you, but that you should wear them because quite frankly you want everyone else to as well, right? Great opportunity for everybody to be a leader and really do it by example. Set the example in your neighborhood. But I will also tell you this, that the piece about children is so significantly concerning to me because of the fact of what I said earlier about those essential workers and now more people having to come to work because of the fact that we're reopening and the children who are at home, who so many of which as a result of everything from redlining to quite frankly discrimination in zoning, right, live in environments with a lot of environmental injustice. And so as a result of that, this is these are the same populations with higher rates of asthma, right, than other kids. And so now just think about what that increased exposure, right, is really going to look like. It is deeply concerning around that issue. We are telling individuals to take every precaution. Rather than wear gloves, I would tell them to take sanitizer and utilize it very often. Take your handy wipes with you. Wipe down everything before you touch it, and then be kind. Wipe it down after. But more than that, right? More than that, you know, it's interesting. When we leave a clinical setting, and certainly I defer to the doctor on all things clinical. I am juris doctor, not medical doctor. But one of the things that I like to say to people is like, for the record, guys, we wash our hands with the gloves on before we take them off, and then take them off and wash them again, right? So I just want to make certain that you understand that, because you are not cognizant of how much you truly do touch, right? You truly do touch. And so, you know, we're saying all of that, but please note this too, right? This virus has been discovered on the bottom of shoes, right? So think about that. So we're really cautious about ensuring that as we go from one ward to the next, right, that those shoe booties are exchanged. So think about when you've got to go out and go to that park and you really need to be there and be everywhere else. And then you come home, right? Are you leaving your shoes at that door? Because I leave mine outside, to be clear. Right? And so I'm just asking people to remember what I feel like our grandmothers actually always told us. You know, so just remember that.
Yeah, grandma was saving the world, indeed. So we didn't know it back then. Now we appreciate that as well. Representative Chakwocha, it's got to be very difficult, right? Being in the position of a policymaker, someone who has to also be responsible for tens of thousands of people in a district. And so in trying to transfer the kind of information you're hearing now from public health professionals in a state like Delaware to your constituents. Talk about that balancing act. What are you hearing from constituents? I mean, one, do you as a legislator and do your colleagues trust the kind of professional guidance that you're getting from practitioners like Dr. Lewis Saint or Dr. Burnett or Micheline, right? So that's one. But then what are you hearing from the constituents? What are some of the questions that they have about how they protect themselves when they start venturing outside?
Definitely, I'll say I know my colleagues were definitely heeding the advice of medical professionals and myself as a licensed social worker, that this is my life, trying to engage with our community and to keep them informed and abreast to best practices, and especially in this term of pandemic when it's so necessary in order for them to stay healthy and keep their families healthy. In dealing with issues in regard to the youth, I found in my immediate district, we have one of the former high school, now it's a middle school, but it's one of the only common spaces that we have a track in a football field. And every day we have a group of youth, teenagers, young adolescents and teenagers coming there every day for recreation activities. Just, someone sending a text, I'm going to play football. Next thing you know, we got 30, 40 teens out there every single day. And that's in addition to the parents who are walking around with children around the track. So there is definitely a need for concern and for us to continue to be just diligent in our message and speaking to the families about the need for everyone to continue to utilize the precautions for social distancing. And when if you need to go to the park, I understand, especially teens, they want to get out. They want to feel that they have their opportunity, that they're not caged in, they're not in prison, but we have to tell them for their safety, that these congregations of really coming together and those type of activities are just not safe right now. So we're, as a caucus in Delaware, we're presenting methods and trying to work on creating strategies statewide to get that message into our community so individuals are heeding the warning from medical professionals.
Also, Dr. Burnett, and oh, by the way, too, before I go to you, Dr. Burnett, everyone can start posing or placing any questions or comments that they have for this session in your Zoom group chat. So you will be able to ask questions of the panelists right now in the Zoom group chat. I see a few questions, few comments that are already there. Also want to thank Marcus Coleman, who's a part of the Healthcare Ready team. He also provides very important information right here. So for participants, go into your Zoom group chat and you will see the Healthcare Ready Pandemic and Disease Outbreak Tip Sheet. It's a tip sheet, it's some guidelines. Some of the guidelines we're discussing right here, right now, you can see at this link. Marcus Coleman, who's on the Healthcare Ready team, just provided that link so you can click into it during the course of this discussion or use that as a reference point, not just during this discussion, but after the discussion. Better yet, share it. Just send it out all over your networks. Just blast it out because people need to see that tip sheet. And they need those guidelines. It could be the difference in a lot of during this very difficult time. So, Dr. Burnett, as the guidelines that you're following and that you trust, right? What are talk about that? But real quick before we get into that, there has been this issue because I know you focus a lot on social justice issues. I know the AME Church has just. That's what the AME Church was born out of, right? Was born out of that fight for social justice. What sort of conversation do we need to be having with law enforcement at this time? Because we don't have the data yet to wrap our hands around it, but we are seeing it. A lot of us have experienced it, Black people being stopped or being harassed because they're wearing masks. So we're between a rock and a hard place. We're being told we have to wear a mask to go into a public space, but then we're being harassed because of some law enforcement, because of bias showing up or racism showing up in the law enforcement. So how do we have that conversation? How do we also start having that conversation directly with law enforcement and providing them with better guidance about this moment?
One of the things, I just had the same conversation with Sister Jackie DuPont Walker, who is the AME Church Social Action Chairperson, my colleague across the aisle. And one of the things that she was saying we need to do is, one, make sure that the medical community, public health community is aligned with our social action people. Mm-hmm. And making sure that we are going hand in hand to the police departments, to the other agencies, the public safety agencies, whether it be on campus or wherever we are, to help them to understand the need, in particular for Black and Brown, to wear masks. Everybody should be doing it, but we have to. It's not an option, it's a must. I saw something on Facebook yesterday that initially made me laugh and then made me cry. Because it was, I can't wear my it was a picture of a young man, couldn't wear his mask normally, a normal mask, but then put on a mask with a white face. So we have to have those conversations. And you're right, the AME Church has been about social action from its inception, and it's become even more important right now. So aligning our pastors, who we've been telling all along, you need to make sure that you have relationship with your police department. It's a must.
Representative, I want to pose that question to you as well. And real quick, before I do that, we had an audience member, Cynthia Williams. She was reflecting on that too during this discussion. There have been incidents of young African-American males forced to remove their masks when shopping because store security felt uncomfortable with their presence. Is there a plan in mask designs? She's asking about mask designs that can help de-escalate white American violence towards mask wearing Black citizens. So that's one thing. But Representative, I want to ask you about, like, are you having those conversations as a policymaker with state and local law enforcement to watch it, to be very mindful of this kind of issue of that animus that shows up in policing with respect to mask wearing?
Absolutely. I think it's very important. We know that racial profiling is, it's a sad core tenement of institutional racism. It's the way in which individuals are viewed, and they have a certain perception, negative perception, mainly, particularly not of all Blacks, but especially Black males. And that helps to justify that negative treatment. And then as long as they have that perception, we know this is pre, post, and we'll sadly during the COVID era, but it's something that we have to deal with. But it's a part of, as was mentioned, racial and social justice. It's our fight. And it's just us enabling, ensuring that our, in the youth I just mentioned, and ensuring that our youth say, you're wearing the mask for this reason, and knowing that if you are stopped by the police, this is what you need to do. Say, I have my mask on for this reason, speak, and let them know why you're doing it, and let them know that you're doing this for safety reasons, and for us to make sure that our law enforcement agencies, from our Attorney General on down, that this is not only about profiling, but this goes in more in depth into how our communities are policed, and all the way to how our communities are sentenced. It's the same struggle. It's just we're looking at it at a different lens during this pandemic, but it's the same fight that we've been having.
Also, we have one of your colleagues, State Representative, State Senator Elizabeth Lockman, actually poses a question. She is asking if there, and so we're going to revisit a little bit of this discussion here as far as about mask use. People are real curious about this, and I get it a lot too on WURD, people asking about that. Nicolette, I remember you were just having a conversation the other day with a group of our elders in Maryland who were really worried about mask use. But Senator Lockman asking, are there any specific guidelines for mask use, reuse of different types, washing frequency? That is a very good question. Any of you can jump in, and I remember, Nicolette, you had answered that the other night. Washing frequency, how to wash, just basics that I would love to share with constituents.
So Healthcare Ready is in the process of developing guidance on this. Part of what's tricky here is there is some federal guidance that we're pulling from and referencing. So we're trying to make sure it's all right, and we're working through that. We will make that available.
Vetting it, right.
Right. There's some general things though that I can share in the meantime. I actually want to touch.
You actually have to vet federal guidance, right? But I hear you, right?
So we are a partner to all. So
Exactly.
what I think I do want to actually mention this, and as we were talking about the question of mask and mask use and the threat associated with masks, there are masks that do have a clear mouth section. So they're designed for the deaf community, so that healthcare providers who are supporting those who are deaf can actually see their mouths as they are speaking. It is very difficult to get them. We're actually working on procuring a set right now for our partners who are supporting those who are in the hearing impaired community. And I wonder if there's a space for innovation there as well. I think it's unfortunate that we have to think that way, but as we were talking, that is something that came to mind as a potential innovation that could help there, because it is something that's being used for a different population, for a different need, but that is something to consider. Unmask use. So I'm going to make this as quick and dirty as I can. So unmask, there are basically three that we're thinking about. It's N95s, surgical mask, and then the hygiene tool I mentioned, the cloth mask.
Okay.
Start with the cloth and work my way back. Cloth masks are what most of us are going to use going outside. What I personally do, what I advise most of my colleagues and counterparts in my age group, no chronic diseases, to consider is lining it with a paper towel. It does help to extend the life of your mask, but as a woman, if you're wearing makeup or what have you, it also gets away from the concern of having makeup rubbing into the mask. So then when you take it off, that paper towel is essentially a liner. It gives you another slight barrier of protection, but that is something that's protective. A cloth mask on average can be washed and reused 10 to 15 times.
Okay.
You do not have to wash it between each use. So it's not that you're getting 10 to 15 uses out of it. It's that it can be washed and reused 10 to 15 times. So for example, I know some folks that do this thing of like, they come in, they spray it with Lysol on both sides. Don't do that, please, because you don't, please. It is dangerous because
don't put Clorox on it.
Don't put Clorox, don't put hydrogen peroxide. The most important thing you can do is not touch the inside of the mask. Line it with that paper towel. Those same hands that were touching everything when you go outside should not touch the inside of the mask. Let it air dry. If you need to clean it, wash it. Just like you would wash your clothes, wash it. Again, line it with that paper towel, reuse. Surgical masks, they're really not designed to be reused multiple times. A surgical mask, I personally, 3 to 5 uses max. And again, you've got to be mindful of not touching the inside of that mask. An N95 mask is really, that is protective equipment. That's really designed for healthcare professionals. For those who are in high-risk populations or having repeated exposures with people, if you cannot, if you're an essential worker and you're at a grocery store, if you are over the age of 65, if you have multiple chronic conditions and you have to go out, it is not a bad idea to have a N95. There are other types of masks that are called KN95s. They are made, they are FDA approved under the emergency use, and you are able to get them. They're actually easier to get right now than an N95. Not everyone needs it again, but you can get those. Again, if you can clean the filter, again, cleaning the outside, damp mask, that damp paper towel, but you don't need to apply a chemical. For most of us who are not in a healthcare system, not repeatedly being exposed, you do not need to do a UV irradiation or chemical treatment to sanitize your mask. You just need to be cautious about using it.
What about, I'm real curious about this. What about throwing masks in the dryer and letting heat kill any bacteria? Does that work by chance?
A cloth mask?
Whether a cloth mask or a surgical mask. I've heard a lot of people ask about that.
No, so you don't want to apply heat to a surgical mask and reuse it. Remember that if nothing else, it's really designed for single use. So once you begin to apply heat and other things that can rip at the fibers, the whole point of wearing the mask is to have a pore size of a fabric that helps to prevent particles from entering and particles from exiting. So when you start applying heat and other things that can break up that pore size and make that fabric looser, you're defeating the purpose. So
got it.
Air dry.
Got it. Also, this is a real good question from Cynthia Taylor, audience member. she's asking about our eyes. You know, we're having a conversation about like the mask, which is for the nose and the mouth, and then gloves for the hands. We haven't had a conversation about the eyes. If anyone wants to jump in here on that, Dr. Burnett, I mean, are people asking about eyes? Any guidance that you want to provide on how to protect your eyes, or if you should at all?
Well, that's the latest and greatest that is coming out now. Is it can be COVID can be spread through droplets in the eyes. That's in the last few days, and so the concern would be face shields or goggles, but I think it's too early to actually make that a blanket recommendation. Nicolette, you agree?
Yeah, I agree. In the healthcare setting where you may see splashes and things of that nature, they're using, you know, swim goggles and all of that, anything to protect the eyes. But I think if you're, again, if your hands are not touching your eyes, and if you're not caring for someone who is infected, you should not need that precaution. I do want to make one point though, and we've talked about this, Dr. Burnett, for individuals who are participating in home health. They are caring for their loved one at home. They should follow the precautions that a healthcare professional would follow.
Absolutely.
Home health is healthcare. So they would need those additional precautions, but that's just not true for those of us who are not in that position. But there are many that we, you know, are speaking to, many that we work with who are home health care deliverers, and they should take all of the precautions that healthcare professionals do.
And that's even more important for those who are not used to doing that. Those that were pre-COVID, not caring for our loved ones at home, just going by and visiting and that kind of thing, or they were in a nursing home or assisted living, and now because of this COVID, you brought them home. You're not used to the day-to-day in and out kinds of protective mechanisms. And so that's one thing we probably need to do a better job of teaching, because they're not getting that education in a real way. And so that may be something that we need to actually venture. Nicolette, can we partner and get that done?
Absolutely.
There you go. That's another reason why we had these micro summits. You know, so we encourage those types of partnerships, people to link up. We love that. That's.
I didn't even think of it until I was
action.
saying it.
Right. That's good. No, that's good. Yeah. No, I appreciate that. Hey, Representative and Michelina, also want you to jump in on this too, but I'm real curious about testing and as we're talking about this, about people venturing outside, but along with reopenings comes a rise in infections and cases, and even more horrifically, tragically, deaths. But are you confident about what's that conversation right now, like especially in a state like Delaware? Are you confident about the testing prophylaxis, about, just because that's a layer of protection, is making sure if we're going to go outside, let's make sure we're getting people tested. Are there enough tests available?
That has been a big charge of our caucus, and all throughout the pandemic. We've been trying to ensure that communities that need testing statewide have access to them. I know our state has recently moved to adding another test. I'm not sure. I know it's a saliva-based test, and you can have less PPE, so other individuals can help administer it, so we can have more testing within communities of need. But it's definitely mandatory. If we're going to begin to open up our communities and economies, then we definitely need to increase testing.
Yeah, Michelina, what's that conversation like at RWJ?
Yeah, so two things. One, the saliva testing that the state representative just commented upon was actually developed by our university partner, Rutgers University in the state of New Jersey. So we have one particular hospital, RWJUH, which is located in New Brunswick, which is where Rutgers is headquartered, although they have campuses in the northern and the southern portion of the state, where we have an entire hospital where every employee is being tested. utilizing the saliva test. We are truly hopeful that for the reasons that have just been stated, that will increase our ability to test so much more. But I will tell you this, that as I serve as co-chair for our state's largest cities recovery and reopening task force, actually it's called a strike force, Mayor Raz Baraka of the city of Newark, you know, our additional issue is not testing in and of itself on its own. It is testing in partnership with contact tracing and isolation, right? So these are really key components that are significantly important, and they really have to go together. Am I confident there will be enough? Interesting. I think that we're going to wind up finding on the back end of this so much more around the issue of the I'm going to be kind today, implicit bias in our medical profession and in the healthcare system as an industry, when we begin to hear that so many of us have gone to healthcare entities 2, 3, I know one case in particular 4 times, and then we went home to die, right? Because of the fact that there weren't enough tests. And so much of that really comes from when you have a protocol that's been developed through a lens of privilege, right? And laced with a little bit of that bias, so that you have individuals who are prioritizing those who are 60 and over, but unfortunately not those with underlying conditions, again, who are younger, etc. So that's why, you know, in the state's largest city, in the city of Newark, the first 2 deaths were African-American men in their early 30s, right? So for me, it is, you know, do I have enough confidence in it? You know, I think that my issue comes to the confidence around the administration of it, right? So hopefully, if we in fact do this in an equitable manner going forward, at least in our we're the pilot for the state, really, in the city of Newark. And so if in fact we get that right, if we do it in a manner which evidences an understanding of cultural competence and of the natural issues that are present in our community, then I am prayerful, not just hopeful, prayerful, daughter of a bishop, Reverend, that we will actually be able to do this in a good way. Am I confident in the system as it is currently existed as a result of the precedent established by what we've seen? No.
Yeah, equitable is the key word, and honestly, I'm glad you raised that too, Micheline. You might have read my mind a little bit. I was going to ask you that question next. You just addressed it, and we're planning on a separate discussion. We're going to need a whole hour, a whole separate micro summit for that discussion, because and I did see, I think the New York Times had just last week did a feature story on experiences with implicit bias, systemic racism in those medical facilities and those hospitals for medical professionals. That's showing up. Don't have a whole lot of data on how widespread that is just yet, but it is. I'm hearing a lot of stories, a lot of folks who are either, you know, will call into WRD during the course of a show and just say, hey, you know, I was turned away, or I felt like I was receiving lacking treatment or disparate treatment compared to white patients. You know, that conversation is happening and it's bubbling up. Real quick, Nicolette. The different types of tests, just for audience education here, what are the different types of tests that we're looking at right now that people need to know about, that people can access?
So there are hundreds of brands of tests, but there are 2 types of tests. There is a viral test that is testing for virus in your nasal passages. That's the very uncomfortable viral swab. And if you've never had a viral swab, it is one of the most uncomfortable things you will ever do in your life. But it is a sensation, I will tell you. But there is the viral test, which is testing for virus. It is testing to see if you presently have an infection. There is then a separate test, which is an antibody test. That is a blood-based test. It is looking for, in your bloodstream, determining whether or not there are antibodies in your bloodstream. The reason that test is important, and I'm sorry, I know all of my Caribbeanness comes out when I say things like antibodies, but it is testing for whether or not you had an infection. So when your body has mounted a response to a pathogen, to the virus, as a part of that, your immune system is going to create these antibodies. That is what the second test is testing for. It is not going to tell you if you are infected. It is going to tell you that you were infected and your body has developed antibodies against it.
Okay, no, it's good. So it's the viral test and there's the antibody test. So, you know, we had the discussion earlier where we have 4 different types of masks that you described, and we have 2 different types of tests as well. Cynthia Williams, also, who's with Black STEM USA. Thanks, Cynthia. I do remember at Black STEM USA, a great source of information on what's happening in the STEM field and how young Black students, too, are participating in that field. And she had a real good question about, how are you doing, Cynthia, too, by the way? Thanks for joining in. The average price of a cloth mask is $10. So she feels like it doesn't seem like an unreasonable cost, but I've been told that some people cannot afford a $10 cloth mask because of very tight personal budgets. Obviously, we got a 15% unemployment rate, fast approaching 20. Is there a concern that seniors and low-income community residents won't wear masks because of the cost? You know, obviously we're having a distribution problem, but there's a cost problem as well. I have seen even masks, you know, when you're ordering them on Amazon, and there is some price gouging that's going on. If folks want to jump in on that conversation, the cost and the availability of these masks.
One of the things that parts of the AME Church, and it's been at many churches, have begun to do is to sew masks and then give them away. One of the things that we have in our part of our guidance is if anybody comes to the door and doesn't have a mask, you give them one. So that means we have to create. There also looks to me, in just watching Facebook, that there are those who are developing companies to do just this. So yes, it's a need. Yes, it has to be addressed. And it may be one of the things that folks who know how to sew or not, or because you can do the non-sewing method, can just get together and so we can distribute.
Yeah, have you heard about that too, Representative? Or I'm sure like that becomes an issue for constituents in your district where people may feel like masks might be a bit cost prohibitive.
Yes, there's a few different from our county government as well as our local city government. They're doing they went out and they purchased masks, and so they're doing giving masks to senior centers as well as the civic associations. So individuals who are in need of masks can reach out to their local civic group, and there are distribution sites in our city and all throughout Newcastle County.
Yeah, Micheline, has that issue popped up as well? Yeah.
Yeah, absolutely. So one of the things that I do within our healthcare system, which is the state of New Jersey's largest, is that I drive social impact and community investment, which is really work that is equity seeking through a policy lens. But as a result of that, we have a number of community-based partners that we work with. And so one of the things that we did as well, because we have so many hospitals, we wound up receiving a great deal from wonderful community members who were at home doing sewing circles to literally even the federal stockpile, but they were KN95s, which while, you know, until our N95s arrived, were utilized, but once they were, we wanted to make certain that we were helping to contain the spread out in the communities. And so partnered with organizations who literally are still on the front line. So the food banks, right? They have lines that are out of the door. And so we provided between 11,000 and 20,000, depends on which, to them as well. And just really wanted to make certain of these masks in order to make certain that as people are coming in order to get food, that they are also being given masks for family. It's something that actually is an incredibly important thing. And we recognize that. Also in that same city that I mentioned earlier, I know that mayor was doing just free mask giveaways on everything from street corners to anywhere else, right? Because they just really wanted to make certain that people who were out, because they were still out at that point, that they do continue to receive the mask and really free of charge.
You know, one last question here too, and Reverend, I know you have to go as well, because I know you had the hard stop at 3. So if you have to do that, please, really appreciate your presence here, being with us, Dr. Reverend Miriam Burnett, head of the AME Church International Medical Health Commission. She's been joining. She might have to jump off in a minute, but I'm real excited about this. Just because you're reopening doesn't mean that you can't maintain physical distancing. I'm using physical distancing now as a term because some people were saying, we don't want to do social distancing. We want to be socially together. But, I'm seeing a lot of restaurants are saying now, like, yeah, we're going to reopen, but we're going to implement physical distancing protocols. They're trying to lure customers back, make them more confident. Businesses are saying, we're going to do physical distancing. Can we really do that? Do you feel confident that businesses are getting correct guidance? I would think that licensing and inspection regulators or agencies would be involved in this. I'm real curious, State Representative, to get your view on that as far as what local and state agencies could be doing in terms of providing that sort of guidance. But that's like, the key word or the key phrase, the buzzword is like, hey, we're going to reopen as a business. You can come back. We've got physical distancing. We're doing it. We're making it happen. But I'm not so sure about that.
Again, I think it's about that risk management. I mean, as we think about opening up, and the other side as far as is how is it really being enforced? We have businesses and restaurants saying we're going to utilize our parking lot. We're going to put tables 6 feet. I mean, how are we enforcing this? I don't know. We're mixing this big pot and it's
Right.
not being enforced. We're trying to go too fast. I think we really need to slow down to evaluate, to really get a handle on where we are as far as testing and secure our community's health before we start moving too far in that direction.
Yeah. Nicolette, did you want to say something?
So I think there's an opportunity here, and I would love to see elected officials and the business community take this up. I wish we could help more, but the health response is exhaustive enough. There has to be a way to think about how we restart the economy without having to physically reopen spaces. And I'm really interested in thinking about what that in-between alternative is. We keep treating things as if it's a zero sum, either this or it's this. And I think there's a gray space. There's got to be a way for us to think about creative solutions that allow for small and medium businesses to continue to sustain in this environment, which is difficult, but they may not have to physically reopen their spaces to do it. Can we stand up state e-commerce sites to be able to do it? Is there a partnership between the larger businesses in the states and the smaller businesses to extend their capacity or to sell their products in these retail stores or grocery stores that are open? Is there something else we can do that allows us to put these public health interventions in place and allow businesses to begin to get more revenue?
All right. We actually gone a little bit past the 3 o'clock hour. I didn't see any other questions that I think we didn't answer during the course of this conversation. But there is in your Zoom group chat, for those who've been tuning in, who've been watching this, check out your Zoom group chat. There's been some very helpful links that have been provided by the Healthcare Ready team. We have Marcus Clone, he's been there. And also I saw Nicolette, you did answer a question Cynthia Williams had about genetic tracking or genetic mutations, a little bit more specialized, that particular question. So, but I'm happy that you answered it for Cynthia Williams. I feel like that's another conversation, another potential micro summit at some point. I definitely want to have some future conversations about the implicit bias elements as well. So we'll be talking about that, I'm sure, in another upcoming CSG, ERC, and Healthcare Ready Micro Summit. Nicolette Lewis-Saint, Dr. Nicolette Lewis-Saint is Executive Director of Healthcare Ready. Go to healthcareready.org for more information. Also, Micheline Davis is Executive Vice President, Chief Corporate Affairs Officer for RWJ Barnabas Health. What is that website, by the way? Is that rwjbh.org? Is that correct?
That is correct.
Micheline? All right, rwjbh.org for more information on New Jersey-based RWJ Barnabas Health. And also we've been joined by Delaware State Representative Nnamdi Chikwocha. He's been joining us as well. Go to delaware.gov. What's for the State House in Delaware? What is that website again? I'm sorry, Representative.
Delaware.gov.
Delaware.gov for more information on what they're up to. And I'm sure they're going to be real busy as we try to get through this pandemic. Thank you all for joining us. I also want to thank Dr. Miriam Burnett, who had to leave us with the AME Church. Also appreciate her participation as well. Debbie Ann Page, Senior Policy Director, Council of State Governments, Eastern Regional Conference, Council on Communities of Color, for making this all possible too. I want to thank all our audience participants and those who joined in with comments. We'll share some of those as well in the Zoom group chat. I'm going to leave that up for a few more minutes if you didn't get those links. And really want to thank everyone for giving us a little bit of their time this Friday afternoon. This is a late Friday afternoon. I know folks are trying to wind down during the week, so really appreciate this towards the end of the day. I'm Charles Ellison. I'm your moderator, your producer, your creator of this series, this Micro Summit series brought to you by CSG, East CCC, and Healthcare Ready. Thank you so much. Please stay safe and stay healthy. All right, and we'll see you next time. Take care.
Thank you.
Thank you.